Good afternoon, everyone, and welcome to our weekly COVID briefing. And I'm just going to start again today. We've going into almost 11 months. We've been dealing with COVID-19. Please wear your mask. And when you go out, socially distance, good hygiene. Keep practicing that. Don't stop. Even if you get the vaccine, and we'll talk to Dr. Hirsch, he'll probably mention it later, they don't know. We don't know whether or not you can still transmit the COVID-19 virus. So wear your mask, and wear your mask. And I think over the next several months, you're still going to have to do that. So be patient. And you see our numbers are declining for 3 weeks, and even though the death rate's gone up here in the city. And again, we've been working together as a group for 11 months as a team here in the city of Worcester. And I know we're talking about the vaccine. The city manager is going to go in depth on the vaccine distribution, but I'm just asking you to be patient. On the local level, respond to directives and the logistics on the state level. We understand there's a lot of frustration. We share your frustration, but working together as a team, we will get through this again. When we first started the testing site, it was a little bumpy when it started, but I know we're resolved to work with our partners here in the city, the state and our state partners, to ensure that people are vaccinated here in due course and time for the coming months. The city of Worcester only receives, going forward, 950 vaccines a week, and I have faith and confidence in the manager and his team, Dr. Hirsch, and our public health department, to make sure those vaccines are distributed correctly here in the city and timely. So again, be patient and be persistent as the vaccine supply increases and the number of vaccination sites expand over time. Just like with testing, the number of vaccination sites will increase over time, and we'll get there together. So in the meantime, again, wear your masks, try to limit your gatherings, and practice good hygiene. And I'm just going to stress again, we've been through this for 10 months together. We'll get through this as a team here in the city of Worcester. I have a lot of confidence in our public health department. We will get through this together. I know people are frustrated. We share that frustration. I just want to emphasize again that we'll get through this, but be cooperative, be patient as much as you can here. Some announcements: the LIFT program for seniors, anyone who needs transportation to a grocery store, a testing site, and maybe even a vaccination site or a doctor's appointment. LIFT will provide access to transportation to the Worcester Family Resource Center, and also for low-income families to access groceries and food banks. And so please contact the Family Resource Center at 508-796-1411, Monday through Friday, from 8:30 a.m. to 4:30 p.m. Please contact again the Family Resource Center at 508-796-1411, Monday through Friday from 8:30 a.m. to 4:30 p.m. Statewide COVID numbers: yesterday, the death toll from confirmed coronavirus cases in Massachusetts rose to over 14,304. This is again an increase of 475 deaths in Massachusetts in a week. Yesterday, the number of confirmed cases climbed over 3,320, bringing the total to 509,503. And nationally, we have seen over 432,000 deaths since the start of the pandemic, and globally over 2.1 million. I was asked to also make an announcement regarding unemployment insurance. We're hearing reports of the slowdowns on the state level when it comes to unemployment insurance and claims. If you're having any trouble with your unemployment insurance, please contact your state representative or senator who will help you work through these issues. And also, Matt, you can contact Mass Hire at 508-799-1600. And again, I know rental assistance, people need rental assistance out there. So I just want to remind people that the city of Worcester has contracted with 5 local housing agencies to offer a rental assistance program. Partner its agencies include Central Mass Housing Alliance, Friendly House, Open Sky, Community Services, Worcester Community Action Council, Worcester Community Housing Services. And if you're interested, please call one of those organizations or reach out to the Housing Department in the City of Worcester at 508-799-1400. Community testing sites, again, next week, week of February 1st, at the Mercantile Center. So February 1st, 2nd, and 4th, that's Monday, Tuesday, and Thursday from 11 a.m. to 3 p.m. if you want to be tested. And we're still in contact with our seniors. We made 785 senior calls this week. Since the start of the pandemic, we've almost made 29,000 calls to our seniors, and we delivered 5,769 meals. So with that, I'd just like to turn it over to the manager. Mr. Manager?
Thank you, Mr. Mayor. As of today, we have 18,829 confirmed positive cases in the city of Worcester since the beginning of the pandemic. That's an increase of 815 over last week. That represents about 70 less new cases this week than the previous week. So just to give you a sense, it does look like we are starting to see a bit of a decline in the number of new cases. So if you go back to the week of January 7th, we had 1,376 cases that week. The next week was 1,219. The next week was 885, and this past week was 815. And so we are happy to see that we're moving in the right direction. We want to continue that, and that obviously relies on folks continuing to do what they've been doing with the mask wearing, the hand washing, the social distancing, and all of the precautions that we've been stressing since February and March. The town of Shrewsbury had another 95 cases in the past week, bringing their total to 2,244. Holden, another 67 cases, bringing their total to 1,099. Grafton, an additional 65 cases, bringing their total to 882. And 45 new cases in the town of Leicester, bringing their total to 781. In the combined UMass Memorial St. Vincent numbers, they have 208 COVID-positive patients. That's down 38 in the last week. That's another positive sign. 48 ICU patients, that's up 2 from last week. As the mayor referenced, unfortunately, 30 additional deaths in the last week, bringing the death total between the two health systems since the beginning of the pandemic to 596. 44 health workers have tested positive in the last week. That brings their total to 1,666. Worcester residents who've passed away, an additional 12 since last week. That brings the total to 367 Worcester residents that have lost their lives since the beginning of the pandemic. The DCU Field Hospital has 33 patients right now. This time last week, they had 51 patients. So again, we're seeing a decline in those numbers as well. Amongst city employees, we have 5 active COVID cases and 7 city employees who are in quarantine at this time. That's significantly down from the high of 32 that we had back on December 12th. Vaccinations. We're in our 3rd week. We just are wrapping up our 3rd week. We'll be having another clinic tomorrow at the Worcester Senior Center. So far, we have vaccinated 2,727 individuals at the Senior Center. We did 2,391 at the actual Senior Center, and then we did 336 through mobile distribution of the vaccines with Dr. Castile going out to a number of shelters and congregate sites. Just to give you a few numbers amongst our first responders in terms of Worcester Police Department, we now have 74.4% of the police department vaccinated, 77.7% of the Worcester Fire Department vaccinated, and 66% of the emergency communication staff vaccinated. In raw numbers, the towns, we've done 56 first responders in Grafton, 77 in for Shrewsbury, 22 for Holden, 10 for West Boylston, 2 for Leicester, and 56 for Millbury. After phase one was opened up last week, it was announced that phase 2 will begin on Monday. So this Monday, February 1st, is phase 2. Step 1 will be residents who are 75 and above. The next phase will be seniors who are 65 and above, as well as folks with 2 or more comorbidities. And then the subsequent phases. We know, as the mayor had mentioned, there is a lot of frustration on the part of residents across the Commonwealth who are anxious to either get themselves or get a loved one who fits the 75 and above category an appointment to get that vaccine. And we share that frustration. The city of Worcester is receiving 950 vaccines a week starting next week for our senior center site. There are other locations that are receiving allocations of vaccine. The hospitals are receiving some of those. We are told that the CVS's, the Walgreens, the other pharmacies throughout the Commonwealth will be coming online in the near future and taking appointments for folks who are in an eligible category. And that hopefully will expand the opportunity. I know a number of folks have heard from their primary care, or when they've called their primary care, have heard either, we're waiting for vaccines, we've got you on the list, we know you're eligible, and when we get the vaccine, we will let you know how to come in and get that vaccine. So I think there's a lot of conversations, a lot of planning, and a lot of efforts going on, but unfortunately, if you go on the state website and look for an appointment, there's not a lot of open slots for folks to be able to sign themselves or their eligible loved one up, and thus the frustration. We're all anxious for more flow of vaccine, as well as more sites that people can access that. And those are really the 2 things that I think we're all waiting for. And we look forward to the state letting us know when they get more vaccine from the federal government, as well as how do we stand up some of these additional sites. We, as a city, have been advocating. I mentioned last week, we've made it clear to the state that we want a super site. We need a super site here in the city of Worcester. The state has assured us that that is their goal. We've identified a location, we've identified a clinical partner, we've identified another partner that will provide hundreds of volunteers to support that site, and we are waiting for the Commonwealth to give us the green light and the date that can happen. So again, we are as anxious as possible. I'm guessing that part of the hesitation is there's just not enough flow of vaccines. And until they have a better sense of what the flow of vaccines are, that might be part of the reason we don't have more of these sites set up, because there's not enough vaccines to support these sites. But we are in constant contact. We've done everything we could as a city to provide all of the things necessary to open a site. We just need to go ahead from the Commonwealth to move that forward. In the meantime, we are going to use the 950 vaccines we as a city get to make sure we continue to provide the vaccine for the first responders and the folks who are in phase 1 who are still trickling in, as well as for our senior population 75 and above starting on Monday who are eligible. But that's not a lot of vaccine for a lot of demand. So we're going to do the best we can to quickly get that out, and then hope that the additional sites come online and the additional flow of vaccine allow current sites to do more, and we can do significantly more at the senior center if we have enough vaccine to do it. We have the volunteer and the staffing, we have the room. My goal would be to go to 7 days a week if we had enough vaccine to actually support that kind of schedule. Town halls, we did a town hall, Dr. Hirsch and Dr. Feinberg and Karen Clark and myself with the Telegram at 1 o'clock today, the Facebook Live town hall. We appreciate that. We did a WCRN earlier in this week, live on the radio. We have scheduled to do one with WTAG tomorrow at 4 p.m. That folks can listen to on 580 AM or iHeartRadio. And on Tuesday, February 2nd, we'll be doing a B Live Town Hall with Mass Live at noontime. So again, these are all efforts on the part of the city to answer to the best of our ability the many questions that people have about, should I get a vaccine? how does it work? What about my personal health situation and where does that qualify me in terms of the phases? Where can I get the vaccine? How do I sign up for it? And we're doing everything we can to be very, very proactive in our communication and continue to try to get the answers that we don't currently have so that when we do have them, we communicate them to our residents who are anxious for the answers to those questions. In closing, I just want to reinforce the importance of all the folks in Worcester continuing to do what we've asked them to do since day one. The mask wearing, the hand sanitizing, the social distancing. Each week we're incrementally moving forward with more folks getting the vaccine. It's not nearly fast enough for any of our satisfaction, and we're going to continue to do everything we can to speed that up. But in the meantime, we still don't have an answer to the question whether somebody who's been vaccinated can carry the virus. And because of that, and because there's a lot of folks who will not yet have had an opportunity to access the vaccination, we all need to keep doing the protocols that we've been doing because we know there are other strains that are popping up around the globe that can very easily present themselves. And we need to stay vigilant and protect ourselves and our community as much as possible until we can get the full, robust distribution of the vaccine. Now with that, I'll turn it over to Dr. Hirsch.
Thank you, Mr. Manager, and thank you, Mayor Petty. So the news really is very encouraging that that surge that we saw post the holiday has really ebbed and now is receding. And if we luck out and we don't see these new strains that have been identified, the one from the UK, the one from Brazil, and the one from South Africa, if they don't take over the predominant strain, we may really see the situation improve because I think there'll be more needles in arms, more and more people will be immune, and it'll be harder for the virus to find hosts, which is great. But the if there is, if the UK strain or any of these strains, which seem to be more transmissible, do take hold and outstrip the current strain, it's just very possible that we could see another surge, which is why the mayor and the city manager's emphasis on the 3 W's is still very, very important. We really need the community to continue to be as diligent as they've been about wearing their masks. We've already seen the great effect that wearing masks has had on the flu season. We haven't had the kind of twindemic that I was really worried about back in the fall when I was asking everyone to consider getting a flu shot. And the main reason seems to be that the masks have really cut down on that kind of respiratory spread of the virus. So maybe masks are going to be kind of with us for a while. Maybe every late fall, early winter time, we'll be finding that it's advantageous for us to continue to wear a mask. And I think now with our new CDC team that is going to be directing our COVID response, I think that a lot of better research and better data and just encouragement about mask wearing is going to hopefully help a lot of the country realize that the mask is not a political thing. It's basically a self-preservation thing. I want to also acknowledge the frustration that we have at the Department of Public Health about how many calls we've gotten. We got close to 800 yesterday about seniors who were concerned that this was their time and they wanted to sign up and they wanted to get an appointment, and we didn't have the mechanism to do that or the vaccine availability to do that. I think this is all going to come into play in the next couple of weeks, as the city manager outlined, and we're going to get there together. if you were 75 years old, you were born either right at the end of World War II or the next year, and your parents had probably been serving in the war or helping out in defense plants. They'd been through the Depression. If you're older than 75, maybe you were serving in the war. But whatever it is, think about all the things that seniors have endured to get to today and be 75. They went through the Cold War, the Korean War, they went through the Vietnam War. We had so many challenges along the way. And the one thing that we can always count on seniors for is the long view. They're not rash. They're not the kind of people that make snap judgments, and they've seen everything once, so they're not so freaked out. This is a little different. We haven't seen a pandemic since 1918, and there's nobody around from that time to give us the wisdom. But I will say that most of the anxiety about this is really in the children of those seniors. And that's because we love our seniors. We love our moms and dads. We don't want to see them at risk, and we know they're very vulnerable. But we know that too, and we feel that anxiety and that pressure to do the right thing by them, and we will. We just need to get more vaccine and a better platform to get them their appointments, because they can't all use the internet. They don't know how to navigate that, and we will get it done. It's just a matter of a couple of weeks, I think, to get the infrastructure together. The distribution center we have at the senior center has been working like a charm. The volunteers have been great. The setup has been great. The quality of the care has been great. The patient satisfaction has been great. We're very, very proud of how that looks and works. And I think with more vaccine and more days of the week, like the city manager said, we could pump out a lot more needles in arms. And if you're a fan of the show Mandalorian, which I am as an old Star Wars fan, you will understand what I'm saying is that is the way. The only way is needles in arms. And we'll get there. So I don't really have much to add. I think the family health centers and the med centers have all been experiencing diminishing numbers, and we're very happy. Unfortunately, with the diminishing numbers, the deaths, which always lag behind, pop up, and it makes it seem much more dire, and it really is an astounding thing when the CDC predicts that by mid-February we might have as many as 500,000 deaths since the beginning of the pandemic. It's just unbelievable. But I'm hoping that with these needles in arms, we will get out of this, and I think over the next 2 months it'll be a little bumpy still. We're still flying that plane that the city manager says while we're building it, but we'll get there. So the last thing I'll say is just as a shout out, 35 years ago today, around 2 in the afternoon, I was changing a dressing on a very, very sick kid in Philadelphia where I was doing my fellowship, and her family had the TV on in the room. And because Krista McAuliffe, a teacher from New Hampshire, was such a big part of that team that was on the Challenger, so many of the school-age kids were following her every word. We didn't have internet back then, but she had really been encouraging everybody to watch the launch and watch the mission, and there were all different kind of experiments she was going to be doing from space that they were going to televise, and everybody watched in horror, myself included, when the Challenger blew up and all the 7 souls were lost. So I wanted to pay tribute to those 7 souls, and also to say that, you know, we came through that, and we persevered and actually, you know, built an international space station, and there's renewed interest now in space exploration after many years of that having kind of suppressed our interest. And I think that we're going to get through this challenge now with the pandemic, And I think there'll be renewed interest in shoring up our public health departments all over the country, because I think that's become recognized as a first line of defense for these kind of horrible viral attacks that unfortunately, because of climate change and a lot of other things, I think may become more regular than once every 100 years. So thank you for listening, and remember those poor souls on the Challenger.
I just had one quick one, maybe for Dr. Hirsch. The death number, you had mentioned just a minute ago that, as you have throughout, that it's a lagging indicator, that it seems like a high number. Is there any other rhyme or reason that you're hearing from the hospital, or is it just simply the percentage of the numbers just bore that out?
Well, I think, when we had these really, really high numbers right after the Christmas, New Year holiday, there's only 3 ways for patients to leave the hospital, and one was going home, and one was going to the DCU center, and one was unfortunately passing away. And I think we've reduced the likelihood that people are going to pass away from this disease with some amazing therapeutics that are out there, monoclonal antibodies and convalescent plasma, and the use of high-dose steroids and remdesivir. So we have the therapeutics down from all the experiences we had in the spring. But despite all that, there are still, and we don't actually know what predicts this, there are still individuals that when they get exposed to enough of a viral load, they're just going to be overwhelmed. And we will probably figure this out by the end of all of this. But for now, we just know that when there's just that many patients in the hospital, there's going to be a lagging but depressing stat that comes out that the deaths will go up a month later.
Thank you.
For Dr. Hirsch, before you go too far, for the cases, the new cases in the hospital centers, are you seeing them among just people who haven't gotten the vaccine, or is anyone who's gotten the vaccine among those cases?
That's a very good question, Mike. No, we haven't seen many folk that have been vaccinated that have gotten the disease. There have been a few. The interesting thing is the folks that have gotten it have usually only had 1 dose. So that's really another emphasis, that don't think that once you get this first dose that you got more immunity. You probably have some more immunity, but that booster is really what kicks in and makes you not get the viral illness yourself. What we don't know, and I think the mayor referenced this too, is are you still potentially a spreader of the disease, which is why we think the masks are going to be needed even after we've gotten a lot of needles and arms, because we just don't know how many folks are still carrying it. But once it gets to the point where we have 75–80% of the community immunized, there are just less people for the virus to infect, and I think it will recede.
And then on that point, just Dr. Hirsch, one more follow-up on that. If someone who's gotten the vaccine, are you also recommending that they continue to, not go to large groups, not go to large gatherings, not see necessarily some of their family members, because they may be able to spread it?
Yeah, I would absolutely say that's true. Gotten a lot of questions from folks. I got my vaccine. Can I go visit my mother now? Or can I go visit my unvaccinated kids now that I've gotten it? And the answer is no, not certainly without all the protections and trying to do it as much as you can outdoors and not in a confined indoor space. I mean, that's another big concern, is now that the restrictions on in-house dining and the curfew have been lifted, that people don't really pay attention to that as well. So we really have to keep drilling down the recommendations that you still have to do those 3 Ws, and don't use the in-house dining thing is an opportunity to just leave your mask off for hours and hours while you enjoy beverages and talk.
And just for the city manager, quick one. Could you share the location or the providers for the super site?
I would like to, but I don't want to get ahead of the state. I need the final kind of sign off from the state. So as soon as we can, we will.